Welcome to the Listen Up podcast, where we explore hearing loss, communication, connections, and health.
Hi, this is Dr. Mark Sims here. I'm the host of the Listen Up podcast, where I feature top leaders in healthcare. This episode is brought to you by Arizona Hearing Center. I help patients to effectively treat their hearing loss so they can connect better with their family and friends and remain independent. The reason I am so passionate about helping people with hearing loss is because I lost my brother Robbie twice. First, from his hearing loss from radiation to his brain when he passed away. I only care for ears. I'm the ear of ENT who's performed over 10,000 surgeries over the past 20 years, and I've taken care of thousands of patients with hearing loss. I'm the founder of Arizona Hearing Center. I'm the author of Listen Up. It's a physician's guide to effectively treating your hearing loss. If you want to learn more about that, go to listenuphearing.com. And for my clinical practice, go to azhear.com. Today, I'm excited. I have Dr. Christopher Conway. He's the director of the Brain Learning and Language Laboratory at Boys Town National Research Hospital. He obtained his PhD from Cornell University, his Master's of Arts in Psychology at Southern Illinois University, and did his undergraduate degree at Duke University. His research is focused on how the brain learns language. This is a really interesting topic that I'm excited to learn about, and I'm excited to have him on Listen Up today. Chris, welcome to the show. Thanks for coming on.
Thanks. Thanks for inviting me.
So, tell me about your journey. I was asking you in the warm up, you were telling me you did a dual undergraduate degree in electrical engineering and biomedical engineering. And then you're now in, how does the brain learn language? I mean, I'm sure there's a connection, but tell me about your pathway from the one to the next. I mean, it's always fascinating to me how people end up, in these areas of research.
Yeah, no, that's a great question. I think I always liked math and science, but I was also drawn to humanities in high school. And so I've kind of always liked a lot of different things. And I settled on engineering because that seemed like a good degree to have. A lot of people gave advice like you can't go wrong with an engineering degree. And I got the degree and I got a job as an engineer at college working in a dog food factory. Wouldn't have thought I'd end up there, but factories need engineers to program things and work with equipment. But I was just not happy. It was not
Wasn't what you wanted to do.
Right. And so took some time off and had saved up money and started taking some classes at Southern Illinois University, and took an intro to psych class for the first time, and was just kind of blown away because I really liked the marriage of science with people and, more of the kind of humanities and subjective kinds of things. And that got me interested in cognitive science and cognitive neuroscience and the brain. And from there, I got a PhD and then sort of gradually became more interested in issues related to language and learning.
So your PhD was in psychology?
That's right.
And What did you work on in your, what was your area of focus in your PhD?
Yeah. So around the time I started my PhD, there was really sort of a revolution in cognitive science related to the power of learning. Because traditionally in cognitive psychology, there was sort of an emphasis or an assumption that language, for instance, was innate. So children are born with knowledge of what language is, and it's a matter of trying to map sort of their language environment to the knowledge that's already there. But in the late 90s, there was increasing sort of realization based partly on empirical data that actually learning is more powerful than we think. The brain can do a lot more than we previously thought. And so I entered graduate school around that time of those initial studies and became just fascinated by it and got kind of captured in the whole idea of trying to understand what are the limits, what are the constraints on our brain's ability to learn.
So like neuroplasticity, right? That there are functions that can be gained through learning. It's not just, you're born with it, right?
That's right. There was, an assumption or the thinking was that early in development, there can be a fair amount of plasticity and change in the brain. But then after a certain point in maturation, things kind of get rigid. As an adult, you can do less. It's harder to learn language, for instance, as an adult.
Or shed an accent, right?
Yeah, exactly. And those things are all true, but it turns out the brain is constantly changing and adapting and generating new neurons and making new connections among neurons. And so there's a lot more plasticity happening than I think we thought, 20 or 30 years ago.
Yeah, I always wondered if it was just, I mean, as we all know, as we transition to adulthood, our responsibilities become greater. And so the ability to dedicate as much of our cognitive load to learning language or shedding an accent just kind of goes down.
That could be, yeah, exactly. Like just sort of
You gotta earn a living and feed your family, so you don't have time to spend time.
Less time for kind of opening of experiences and
Right.
exactly. So almost like entrenchment. The more you learn, the harder it is to learn something new because you're filling yourself up with other.
Oh, well, and normal daily activities, right? What you have to get done each day. I mean, I think about the beauty of kindergarten, right? It's playtime. You just go and play and explore whatever you want.
Right.
And so it's a little bit. Unfortunately, my days are a little, and perhaps yours too. They're a little bit different than circle time.
Yeah. Yeah.
So, well, tell me, what role does hearing play in learning language?
Yeah. That's a good question. So I wasn't initially interested in hearing or hearing loss or deafness until I started my postdoc work. And the PI I worked with was David Pisoni at Indiana University. And he was one of the first researchers to look at deafness and specifically language outcomes in children with cochlear implants in terms of cognitive and brain factors that might help understand why there's a lot of variability in language outcomes in children with cochlear implants. And so I was interested in kind of bringing in my experiences doing research in learning to try to, come up with some insights into what was happening to these children. So it's it's a complicated issue. So clearly, hearing loss will degrade auditory input, language input. So it makes it a formidable challenge to learn language.
Right.
That's clear. But beyond that, it turns out even if you control for sort of audiological factors and demographic factors, like how well actually is the device, the hearing aid or cochlear implant working, what kind of input is the child getting, or what age did they get their implant?
Right.
Even if you kind of look at those things and kind of control for them, there seems still to be different learning happening in children with cochlear implants and with hearing aids. And I think there's something going on in the brains that's leading them to process information differently.
So when you say there's different learning, you mean the way they get there. In other words, whatever the learning mechanism is for language, it's different than a normal hearing person?
That's right. Yeah, that's what the ideas that I've been exploring in some of my research. So there's sort of, you can think of it two ways. So let's take a child who's born profoundly deaf, receives a cochlear implant at some point in their life, let's say age 2. So they've gone 2 years with very little auditory input. They've also gone 2 years with probably very little language input, unless their parents or caregivers are, deal with sign language and might expose them to that. But let's say in the case they've had very little experience with language. So the question is, well, how does the brain react to that? So you've got one whole sense modality that's just not there,
Right.
and the brain is not learning language, which is something that's super, super crucial that happens in those first few years of life. So there's going to be changes, that goes without saying. And I think those changes are changing the way that after sound becomes available, there's a lack of experience with dealing with an auditory signal and a linguistic signal because of that period of deprivation that happened.
Right. Which is longer than 2 years, right? Because we know in utero, there's hearing.
Great
Right?
point. Yeah, great point.
And so, is it, the teaching has always been from us clinically, right? Is that, the outcomes are substantially kind of it's like that the 2-year mark is kind of the some sort of mile marker that before and after does change the potential outcome. I'm not sure it's really true. It might have been in the past. It took us that long to get them through all the evaluation to get them ready for a cochlear implant. And I think we're getting better at it. But is there some documented change that does occur before and after 2? Is there some milestone there?
I don't know if there's a milestone, but clearly earlier seems to be better for sure.
Right.
And
is there a back end milestone? do you think, in terms of plasticity? Just based on the research. I'm just curious. I mean,
back end in terms of
meaning like, we used to, the other thing that was always kind of the teaching was like at 5, that kind of becomes, the outcomes are going to be, and I think it's retrospective, right? And the problem is if somebody, when you learn their language outcomes, the way we taught the language has changed by the time you learn their language outcomes, right? So it's hard to know.
Yeah, and it becomes, I think, increasingly difficult the older, the later the implantation occurs, just because of kind of what we're saying, as your brain becomes entrenched and used to doing different things. Now, those language centers and those auditory centers are being used to do different things. And so
there's not like brain capacity sitting there waiting for that input.
Exactly.
And so is there any modeling of what maybe if you do become proficient, do you, I mean, I'm not a neuroscientist, so forgive me, but like, do you take CPU power from some other power process that, you were doing? Is there shown any loss anywhere else, or is the brain so plastic you can do both?
Yeah, there's different theories and different ideas about how plasticity plays out. So one is that, for example, the auditory centers might be taken over by visual or tactile senses.
Right. And people have always talked about that your other senses are keener when you lose one, right?
Right. And I think there's some evidence to support that.
But it's not a total substitute. I think that's probably the misconception, right? Like it's like, if you could do units, right? If you have 100 units of sensation and you lose hearing, it's not like the 20 units go across the other 4 senses. So you get 25 units of each. It doesn't work that way.
Yeah. Yeah. In a way, there's sort of the different perspective would be that you don't have as much experience dealing with multimodal, audio visual processing.
Putting it together, right? The hearing and the visual stimulation.
Yeah. And that's a big part of our, for people with typical hearing, that's a big part of our experience, is not just hearing and not just seeing, but matching those things together. And so the brains aren't doing that either. And so all these things are getting filled up with, different things.
So does that catch up? The integration between the visual and the auditory? Do you know?
That I don't know.
That's a really interesting question. Because, when I talk to patients, I talk about the difference between communication and hearing, right? And so obviously visual, speech reading, all of that is so important. And so it's interesting if that actually catches up and normalizes compared to hearing and visual. So there you go. Well, figure that out. Let me know by next week, would you?
So another related to this that might be of interest too is some of my work touches on sequence processing. So the ability to learn, the order of events or the order of stimuli that you hear or that you see.
Interesting. So like, how do you test that, and how does that practically apply?
Yeah. So one type of paradigm, and this was some of the early work done in the 90s that I kind of had mentioned in passing, is to expose people to auditory input, sort of nonsense, streams of syllables or auditory tones. And it just sounds like gibberish. Right. But actually in these patterns or in the input sequences are regularities and patterns. So some stimuli or syllables, if that's what the stimuli are.
So there's a repetitive part, even though there's an overall chaos to it, right?
Exactly. So there's some amount of redundancy and a pattern in there. You don't tell the people there that that's the case. And after the experiment, people will say, I didn't notice anything, unusual about input, except it sounded kind of weird. But there's lots of different ways to measure that people are actually picking out the patterns. And so why is that important? That's important for language. A lot of language acquisition is learning what these patterns are. So what words follow other words, or what sound syllables, cluster together to form a word.
Right.
And it looks like the research that we've done suggests that children with hearing loss, they're not picking out these patterns as well.
So it's like auditory syntax.
Yeah. Yep. So very related to syntax, to sort of phonology or phonotactics. So, each language kind of has its own rules for what sounds can combine together. Yeah.
And so that is a lost skill or a lagged skill?
It looks like it's an open question, but I think it's a lagged skill. But the children who seem to retain that skill to some extent, they showed better language outcomes. So it kind of goes back to, my interest in the brain's ability to learn. It looks like how some children are learning patterns is different, and that difference plays out in real world things like language, and part of the reason why they're not picking up language in the same way that it's hearing child.
Well, that's fascinating because then, perhaps your rehabilitation would be more targeted towards those skills than the actual. I mean, because our rehabilitation's always just been, let's expose you to language and you kind of will acquire it, if that makes sense, right? And so maybe it's kind of like the ultra athletes who try these cross sports to try to get better at their own core sport because it helps them develop skills that have a cross application or something.
That's right. I mean, you hit the nail on the head. I think if there are these sort of deeper things going on in some children's brains, then it might change how we think about rehabilitation or intervention and language therapy. Instead of just trying to give them, instead of doing what the normal, practice of maybe a speech language pathologist, maybe we got to think about, how can we help them learn these patterns, or what kinds of input do we need to give them to facilitate that?
Do you think there's any modeling in mathematics education that would be extrapolated to this? Because it seems like that's in some ways a more concrete concept of learning. I mean, multiplication tables are every young child or the parent of every young child's bane of their existence till the kids master it, right? And it's that, I mean, that's a simplistic example, but it seems like it's similar to that type of learning.
I think this type of learning plays out in many, many things. It may be more so in more informal learning situations. So it may not be as relevant to a teacher explicitly saying, 2 times 2 equals 4 and, memorization. This is a little different. This is more sort of picking up passively the regularities and patterns. And I think it does happen in math, but it may not be in all situations.
Right. Yeah. Well, I mean, it certainly might even feed into, some of the higher executive skills are noticing patterns in a different way, not from an auditory point of view, but from a repetitive human interaction point of view or something like that. I don't know if it's of the same nature, but it's an interesting thing.
Yeah, I think, the appeal of this area of research, which is referred to as statistical learning, because the thought is that you're learning statistical regularities in the world. Right. But the appeal is that it seems to cross over into so many things. Like you said, social interactions, like even now in our interaction, our brains are picking up on cues, maybe, right, on the other person, and that changes how we might interact. And we're not consciously thinking of these things, but our brains are doing it.
Well, yeah, it just shows you how important language is, right? Because it's the commerce of human relationships. And so until you have access to it, that doesn't happen, right?
That's right.
So are you doing it in other languages? So other auditory languages, or is it all in English, your work? And how about like sign language? Are you doing any work in that as well?
Yeah, some of my work was actually with visual stimuli as a way to try to
get rid of the auditory component.
Yeah, divorce from the auditory component and divorce from language as much as possible too. So let's just pare it down to.
So you're measuring people with a hearing impairment and then trying to measure it as a visual skill and seeing it. Okay, that's fascinating.
Yeah, and then see, does that relate at all to how well they learn language? And it turns out there is some relationship there. So the children, even these are visual paradigms. There's nothing linguistic about it. It's not overtly.
But people use the auditory skill to help the visual skills. There's some cross skill. Is that what you're saying?
Yeah, it's true. Yeah, exactly. It's a little counterintuitive, but there, to some extent, this learning ability seems to cut across perceptual modalities and domains. And so not entirely, but if I'm good at visual learning, I may also be good at auditory learning. Not 100%, but there is some relationship there. So there's some sort of central mechanism that is guiding these processes across different perceptual domains.
So you're measuring it in the visually impaired too?
I haven't, but it's something I would like to do.
Yeah, because obviously that's the antithesis of the experiment, right? To see exactly that would then isolate it to if it's auditory, and then obviously there are some people have the unfortunate of both visual and auditory impairment, right? Like so Usher syndrome or something. So boy, you could. All right, well, you've got at least a couple of decades of work there, I think.
Yeah, plenty to do.
And so. Getting back, how about people who use sign language? I mean, so is there a temporal, or is there a sequencing issue there that's developed? Is that different, or is that not known?
Yeah, no, that's a great question. So sign language. So I'm not going to pretend to be an expert, but sign language is interesting because at least in terms of the brain, there's a lot of the same sort of brain networks that are involved between sign and spoken language. Sort of the classic language networks, which is sort of frontal areas, Broca's area, and then also sort of more posterior areas, Wernicke's area. So comprehension and production is one way to think of it. Those same areas are active in sign language, but there are differences too. So sign language involves parts of the brain that spoken language doesn't generally rely on as much. So like spatial areas in the brain, which makes sense because sign language is partly a spatial skill, perceptual.
This stuff's fascinating. Like, how do you measure this stuff?
So I haven't personally done that work.
But I mean, what tools do you use to measure for your lab, for your experiments? So what are the tools used to actually perform these types of measurements?
To look at different brain areas would generally be functional magnetic resonance imaging, so fMRI. Those are 90% of, if you read a news article or see a blog or whatever, something that shows the image of a brain, probably, fMRI studies.
So are you using that in your studies?
I've done one study, but that's not the primary tool I use. So I've mostly used neurophysiological measurements. So looking at electrical activity that's generated in the brain, but measured at the scalp.
Okay. So like sophisticated EEG type of thing.
Exactly. And so what that gives you, unlike fMRI, it gives you a nice temporal time course. So you can look at processing that's happening at the millisecond level, whereas for fMRI, you're dealing with way bigger, seconds or more.
Right. The delay of the imaging and the reflective what's going on is there's a bigger lag.
Exactly. So you have a really sort of nice, precise measurement online as it's happening, looking at brain information processing in real time. So that's the appeal of EEG and event-related potentials, which is a type of EEG technique. And so we've used that to look at these types of pattern learning and sequence processing and how that might be different between different sort of clinical populations.
There must be a ton of data that you're dealing with.
It's a fair amount of data, which can be difficult, but it can, with a lot of data, there's a lot of things to look at.
I think that's the power. As computing gets better, there's things that we do now that we never would have even thought about doing, 10 years ago in terms of trying to crunch those types of numbers. It's pretty amazing.
Yeah. Now, the downside of that is you have so much data that you can almost find anything you want if you look hard enough. And so there have been studies sort of suggesting that, we really have to be rigorous and careful with the procedures we use and be transparent about everything, because the longer you hunt, you can find something in the data, but it will most likely be what's referred to as type 1 error, which means it's just happened by chance. You found the thing you look for. If you look hard enough, you'll eventually see it, but it doesn't mean it's a consistent, reliable result.
Well, that's why people are trained to do high quality research and undergo mentorship and all that. So I'll just leave that to, your peers and the whole lot. And so where do you see your field going in 5 or 10 years?
Yeah. So with this type of learning, statistical learning, we're actually at I think a crossroads and sort of identity crisis, because I think we're hitting sort of adolescence in terms of this little subfield.
This field.
There was a lot of excitement initially and a lot of interesting research, but now I think people are kind of starting to look back and see kind of the flaws and the difficulties in some of the way we've operationalized and measured some of these this type of learning has not always been consistent across studies. And so it makes it really hard to compare. It's almost like comparing apples and oranges. I might call this statistical learning, but somebody also calls it statistical learning, but is measuring it in a very different way. And you just wonder, are we measuring the same things? Or are these?
So getting generalizations about the progress of the field are difficult because the people are looking at it different ways. So you're not sure you can draw an overall conclusion.
That's right. And there have been criticisms about that some of these laboratory tasks aren't very reliable. So they don't show robust results. So I might measure you on your ability to do this kind of learning today, and then a week later we measure you again and you show something very different. So you got to wonder like what's up with that. Now I don't think it's as doom and gloom as some people have made it.
People have good days and bad days, you know. I mean,
Well,
that's one of the big things that people have to understand. We're not like consistent. Humans are consistent every day, right?
That's true. That's very true.
Especially when it comes to learning. I mean, there are days where I think I can learn a lot, and other days where I'm just not optimized for integrating nearly the same amount of information.
Well, and that I think that is another potential criticism of this work is people don't always consider those things like motivation or
sleep, amount of sleep you've had.
Or I mean, when the undergraduate in your lab is falling asleep during the task, but there might be other things that aren't as obvious to detect. Somebody might just be a little more careless that day, or tired or worn out. It's just not showing the same.
So is that what you do? Most your studies on what, young adults or
combination young adults?
They're available.
Children. Yeah, I mean, in the university setting, they're much more available.
Right.
That's why most psychology research and human neuroscience research involves young adults, college students, because they're available. They're
willing,
or
motivated,
they're getting course credit, or maybe a little bit of money on the side.
Mm-hmm.
So about half of my research up until now involved, young adults, but I've also been doing work with, as I said, children who are deaf or hard of hearing. We did a study with children with developmental dyslexia. I've been interested in brain development and language learning in children from different socioeconomic backgrounds. So that's been kind of a hot topic in psychology and language development as well.
Well, I believe, if you look in the CI literature, the mom is the factors that the mother has are by and large the greatest determinant of outcome in pediatric CI.
Yeah, that's it's definitely a big factor, and it's true across the board. Not just children with CIs, but take any given child from poverty, and then a child from a more affluent background, and there's just going to be a lot of differences in terms of test scores and
right.
Educational attainment, language ability, and there's a multitude of reasons for that.
Yeah. So where do you see your field going in the next 5 to 10 years?
Yeah, I think to go back to what I was saying with the field needs to come to a consensus about how to really get at what this construct is, this statistical learning ability, whether it's a single thing or is it composed of sub components. So I think it's actually an umbrella term that involves a lot of different cognitive processes. And so the way we measure it in my lab, I might be involving A, B, and C cognitive process. Somebody else might be measuring it in a different way that involves C, D, E. And so we have to come to a consensus about what it is these different labs and different, researchers are doing, what's common, what's different. And then we can really understand to what extent these learning abilities are different or atypical in children with hearing loss or children with dyslexia or children with a language disorder. Because honestly, the findings can be a little discrepant. So there's evidence that, for example, children with hearing loss do have problems or do show difficulties with some of these kinds of pattern learning abilities. And then others show that they don't. And it just makes you wonder, is it that the children, the sample is different? Is it that the way they're measuring the learning ability is different? And so the field has to, if this field will continue, it has to answer these really fundamental questions.
So in a lot of ways, it's actually defining what that learning is.
Yeah.
Right. In a high specificity way. So you can compare different circumstances, it sounds like to me.
That's right. And that's been something I've been thinking about. And I just published a paper last year that put forth one sort of idea to resolve what this is. So it's something we're still kind of thinking about.
Well, that's great. You're like on the forefront of developing what the forefront is going to develop. I mean, I know that's kind of a double thing, but I mean, obviously, common vocabulary in terms of research is very important. I mean, when people are talking about two different things with the same term, that becomes a very difficult thing to draw any conclusions. But hopefully that'll happen. So then we can extrapolate, move this, into a clinical realm to have application. Obviously,
that's right. And that's a great, that would be the hope, is that once we get these basic questions sorted out, then we can use it for diagnosis or do it for identification of children who really will likely struggle with language learning because their statistical pattern learning abilities are operating differently. And like we mentioned, early, then the hope would be it might inform therapy.
Well, interestingly, you might find kids who are non-performers in other aspects of their educational process, that this could be a map for that. And then if you could right?
That's right.
Maybe not just as simple as saying, well, I'm not good at math, right? It might be, I am actually good at math, but it's some of the patterns or some of the deficits. Reading's an example. People who don't track lines well don't read well, right? So they know how to read, they just actually don't track the lines well. So it's a kind of an interesting concept in learning.
That's right. And reading is another great example where pattern learning is important. So you're learning what letters kind of seem to go together, and then you're learning what they map onto in terms of sounds. And that is one idea, that people with dyslexia, they're just having problems learning these patterns. So this is definitely sort of at the heart of all these issues we're talking about.
Yeah, it's great, because if you can kind of crack the code, you might be cracking a lot of educational learning struggles, right? And so if people can, this is a great field that I'm going to, keep my eye on, because I think, we'll see, because obviously I'll see it in the cochlear implant children if it has application pretty quickly. I think if you guys get good evidence, the adoption will not be slow, right? If people, because they want more tools to be better at this stuff. So
yeah, great. I would hope so. Yeah.
So Chris, I always ask people, in terms of their mentorship, like, who do you thank? If you were at an awards banquet and and they said, okay, who do you thank for who got you here? Who are those people who have been important to you in get you here?
Yeah, well, for sure, my PhD advisor at Cornell, Morton Christensen, he took me in. Like I said, I was a dropout engineer and didn't really know what I was doing, but I think he must have seen some potential in me, and I thought what he was doing was fascinating, and mostly I trusted him as a person, as a human being. I just felt like he was going to take care of me, and he was going to shepherd me through this process, and he did. He was always very supportive and helpful. So him for sure. David Pisoni, who I mentioned earlier, just sort of opened my eyes in terms of how to make. Because up until that point, I was really interested in more of the basic questions about learning and not tying it to clinical, real life sorts of issues. And he opened my eyes to that and set my research on a completely different path than I would have done otherwise. So for sure, those two people.
Sure. Getting a smaller subset actually makes it a little easier to study too, right? A more focused population.
Yeah. And he, I would never have really thought to work with children with cochlear implants until I started working with him. And, I found it pretty fascinating just because of all these unanswered questions about, well, what's going on, and, why, like, shouldn't we know by now, how to help facilitate, hearing and language learning in these children? And I think there's a lot of open questions still.
Yeah, I think we have to get beyond, we put them in and they work, right? Understand. Right. And that's kind of, when parents come to us, that's kind of what we say, right? Our experience tells us they work, right? And so it's a kind of a, not the best, not the most granular answer for people. But interestingly, it is aside, we don't actually have good granular data for, postlingually deaf adults and how well they'll do from a stratified point of view. So there's a lot of work on getting good predictive data across the whole patient population of cochlear implant patients.
Nice. Yeah.
Because it would actually be interesting to look, do those skills degrade in people with a progressive hearing loss? Right?
Yeah.
Because the cognitive decline side on the long-term hearing loss for older adults, is it actually that is one of the contributors actually some of this pattern recognition is gone, right? Because some of the cognitive overload is actually doing cognitive or pattern recognition of the context of the conversation to fill in for the hearing loss, right? Knowing what people are talking about and your brain fills in the blank. So it's interesting how important that pattern is.
It is, and there's not a whole lot of work in older adults with this, kind of learning that I'm talking about. But definitely, I would be surprised if there wasn't something different in how they're processing patterns, just based on, like you said, what we know about cognitive decline and changes that happen in the brain. So.
Yeah, I think you're going to see a lot more work, being that the connection between hearing loss and cognitive decline are becoming clearer and clearer. So I think you'll see more and more work in that area. So Chris, the other question I always ask people is, what's your favorite sound?
I've always liked the sound of a cat purring.
That's a nice sound.
Yeah.
I just love to ask that question because it really helps us appreciate how much hearing and how important it is to us and how much pleasure it really brings to us. So, but that's great. That's a great answer. I love that. So, folks, we've been talking to Dr. Christopher Conway. He's the director of the Brain, Language, and Learning Laboratory at Boys Town National Research Hospital. Chris, where can people contact you and learn more about you?
Sure. Yeah. If the easiest thing is Google my name, PhD, and I probably pop up. But I have a lab page on the Boys Town National Research Hospital website, so that would be the other way. And my email is christopher.conway@boystown.org.
That's great. Thank you so much for coming on the podcast. I really appreciate it. Interesting stuff. And I look forward to learning more as I watch this field, or we all do watch this field develop. Thanks so much and thanks for the great work. It's a great, really important stuff to do. Thanks again.
Thanks. I appreciate it. I enjoyed the talk.
Thanks for tuning in to the Listen Up podcast. We'll see you again next time, and be sure to click subscribe to get updates on future episodes.